So this is the case of a patient who was not from here. So when he communicated with us from his country, he thought that he needed a lot more. He felt like a lot of his teeth were not aligned and he needed a lot more extensive treatment. But when he came here, this is what we've noticed. So yes, there are a few very obvious things that stand out. Firstly, it is this gap between his front two teeth. It is this canine which is almost sticking out of his smile. And then obviously it is the wear pattern that has begun in his front teeth. So this is how his smile is looking. So let's take a closer look at his teeth. So this is how his top and bottom teeth are looking. Definitely this is the gap that was seen, this is the canine that was standing out, but other than that, what we also notice is the bottom teeth. This tooth is slightly also, quite inside as compared to the other teeth. The other thing is the gum levels. If you see, it's very, very minor, but the tooth on this side is different from the tooth on this side, and similarly over here. So what we have done is we have done a very slight, gum procedure over here to get the height of the left side teeth similar to the right side teeth. We have done a slight gum procedure here as well. Another big issue that he had with his teeth was the shade. So usually people who are not from here, they prefer a much brighter, whiter smile. And also the other thing was that he found his teeth very, very bulky. So what we've done is we have involved the number of teeth that was seen when he's smiling. So that's the upper 8 as well as the lower 8 teeth. We have slightly tried to get it more in the arch form. We've reduced the bulk. We've got it slightly flatter. Obviously this canine was also treated so that we can get it back in the arch form. And we have given him veneers which were much brighter than his original shade. So this is how his before and after is looking. So this is pretty much what he wanted without knowing the treatment for it. The proportions have been corrected, the shade has been corrected, gum levels have been corrected, alignment has been corrected. And this is the final smile. So this is something that is definitely better suiting his face. This is something that he wanted. This is something that he can carry off. And yeah, safe to say that he is left as a very, very happy patient.